mu butumwa bwe ubyabanaga hamukoro gwo kwiguraho Emergency Operations Center urukora nkamukuru w'irware rikuri ryambara Dr. Deus Twesje yayiriko kweraritserera aba contracts z'abakugu ababiri bakora home isolation center ukwaho umurundo gumwe.
We have got 9 experienced workers who have been manning that place for the last good years. They have had training. They have actually intervened in most of these previous outbreaks, but the unfortunate part of the hospital is that they are only remaining with 1 week and a half. Come 31st of this month, their contract is expiring.
Dr. Deusi ashobora contracts z'abakugwaba ndizo hebirasha tunacume ibyo kwezoku ati nuko kwiga ibitongore byose bishagika government hamwe na government kokoro buceka ihembe urebeka nguza contracts z'abantu aba zagarura busya.
We have tried locally to see how we can maintain them here. We are hitting a dead end. Cases are increasing. The experienced staff members are closing on the same day.
Wahati irwaro Erikuru Mbarara hariho abantu abarukurenga muri mwenda abayine ndwara ya monkeypox kandi abarukureberwa abakugaba. Dr. Deusi nagira ngo bayino kweraritserera ngo abantu babasa kweyongera mbero bikuru ebiturukuzamo.
As Mbarara Regional Referral Hospital, we are taking this as a serious matter because we keep on getting an image of what will happen on 1st of January 2025 when the number of cases has doubled and every staff member has gone.
Gurigiraha Dr. Aran Muruta, or Commissioner Integrated Epidemiology Surveillance and Public Health Emergency Ministry y'ebyamagaro mu ihanga nashobora gavumenti iza kwatanisa n'ebitongore bitari bya gavumenti ebyo yose ni kwatanisa nabyo ukongeza za contracts z'abakugwaba.
Government iza kutaho uburyo bukureba ngo abantu abo bafuna contracts zindi abakorana ba development partners.
Irware rikuri ryambara rikora ha districts 13 kandi nyinja hariyezi zirimo abarisa 20. Ugurigira ha Dr. Twesje ikintu cyongesereza amuhendo gw'abantu abari kurwara indwara z'amatungo.
Tugira ngo twagizire inyama yishaha iziri kugira indwara kandi indwara ikatambuka ikazumbantu abantu bakashasha bakafa tukakora ki tuyikirizana na Ministry y'Ibyamagara ngo baturetere iki kiba leta baturetere ubu buhereza ubutwayeta EOC uburi kwijana abakugu abakugu abayija nibazakoroka kumanya indwara aho yagira aho yaretwa nibaza kukimanya kare nibazayo nibashomesa abantu nibashomesa abarisa nibatanisa abantu abaruire n'abahurire kandi baraka no kubihayo.
Umwanyugu ogwatongozebwa ndwija kwejunisibwa okumanya indwara zo mubwire hamwe no kuzirwanisa.
Uganda is now fully impressed with this concept of EOC because you cannot manage outbreaks if all of you are stepping on each other. So coordinating, and this is a center for coordinating all efforts of prevention and detection and response.
Dr. Muruta yaigabanya Uganda okufayo munonga okwerinda umwanya gwo kutegereza kwatwa bakaza kujanja bisa.
Activities through data monitoring, data utilization, and being able to pinpoint where there are risks and propose prevention and preparedness.
Oyihireho okukora abantu okurwa mu districts 13 ezirimo no Rembo urwambara araho n'abantu abari kurwa mu mahanga agetorere Uganda agari mu ihanga rya Congo, Tanzania hamwe n'ihanga rya Rwanda. Gandi abakozi omwirwareri bakiri bake abuceka 23 aharigana ikiri kuretaho okweraritserera Abebeembezi b'irwareri. Aba Sky TV agenshonga ndimatenebi.